where the stories collide. David Mathis brings truth as our guide. From every walk of life and point of view, every voice here has wisdom for you. Lessons for life echo loud and clear. Faith and love in every word we hear. Through the struggles, the triumphs, the fight, we find the light. In lessons for life, Santa speaks of joy in the giving hand. A polio survivor find the will to stand. Bold messengers don't shy from being called to share. Each person has a touching tale of care. Lessons for life echo loud and clear. Faith and love in every word we hear. Through the struggles, the triumphs, the fight, we find the light. In lessons for life.
And now, make him welcome, Pastor Dave Mathis.
I'm here in my home in a little town called Union City, Michigan. And I'm calling up somebody tonight that I know real well, that's from a little town called Athens, Michigan, which is about 5 miles away from me. So would you put your hands together for Sara Stanton? Hi, Sarah.
Hello. Thank you for having me. It's a pleasure to be back here again.
Yeah, this is like your third or fourth visit, isn't it?
Third.
Third?
Mhm.
We've had you on every topic. Now, tonight we're going to have you on health and medicine because you are a TA. Is that right?
A PA.
A PA. I got it all wrong. You're my PA. And would you do people a favor and tell them how you're related to being a doctor and capable of looking at somebody like me and giving me health advice?
Yes, absolutely. I am a physician assistant, also known as an allied professional, along the same lines as a nurse practitioner. And we work both independently and with a supervising physician. So we see the patients, we write the prescriptions, we do minor procedures, and just in conjunction with a physician.
Now, you've been doing this for how long?
19 years.
And since I've chosen you, everybody who's watching is going to know that you're real good. I would like to start out with, like we always start out, with a Bible verse. And could you give me a Bible verse that sort of hits what we're going to talk about tonight?
Absolutely. We decided on 1 Corinthians chapter 6, verses 19 and 20, and it says, "Don't you realize that your body is the temple of the Holy Spirit who lives in you and was given to you by God? You do not belong to yourself, for God bought you with a high price, so you must honor God with your body."
So, what does that mean to people that may have lost track of what you were saying? What does that mean to you?
It just means that our body is a temple and we can honor the Lord by making ourselves healthy. And in turn, it mentally helps prepare us to become closer to the Lord when our bodies are working well for us.
Let's start out with this because we're going to talk about a lot of things tonight. We're Christians. We believe that, at least I believe, and I think you do too, that Christ is involved in our health and healing and medicine. Did I say that right?
Absolutely. Absolutely. I always can tie it in with the Lord. We have to do everything we can do on our own, and where we fall short, God provides. And that's whether we're the patient or the provider. So we always have to know that. I don't have all the answers, and the patient doesn't have all the answers. There's one person that does, and we have to draw upon that. And I feel that that's very important. And I feel that patients are very responsive to that as well.
Which brings up another thing for Christians and non-Christians. This is something I think about often. Some people don't believe in going to a doctor. They believe they can get all the information they want to off the internet or by calling friends. Some don't even believe in going to a doctor or getting shots. They listen to somebody on TV that said something. Would you comment on that?
Yeah, absolutely. I think that changes as we age. When we're in our 20s, we can pretty much do things on our own, but you can only rob Peter to pay Paul every so often and for so long. And so I do believe it's important. I am under the believing that an ounce of prevention is worth a pound of cure. So I like people to have good control of their own bodies and their own health in order to minimize the amount of medications. I always see it as a failure if somebody says, I'm not going to really do what you recommend, just give me a pill, because then I'm going to have to give them another pill to combat the side effects of that medication. And, food is medicine. Um, and so is our faith is definitely a great medicine. I always say, whether you think you can or you think you can't, you're right.
That brings up something that I've been thinking about. How often should I see a doctor if I'm feeling well?
Mhm.
Should I have an annual physical or should I have one twice a year? Give me some clues, will you?
Yeah, that's a good question. Definitely, we need to see people yearly. There are preventative tests that need to be done, and we can take care of that in that yearly visit. And from there on, it really does individualize, and it depends on what problems you have. As we age, we see people more, we see our provider more often, but definitely need to be seeing your provider once a year. There's so many things that we can prevent if we do see you. And if we don't see you for 3 years, you're not going to get the most out of that visit, because there's going to be so many different problems and we won't be able to address all of them.
You know, medicine's changing, at least physicians.
Mhm.
A few years ago, in the rural areas we live in, there were doctors all the time.
Mhm.
Today, there's less doctors and there's more nurse practitioners and people like you doing that.
Mhm.
And I just wondered if you could give me a clue on how you pick a good one. If I'm looking for a new doctor or I lost my doctor, exactly what should I do?
Yeah. Well, definitely it is always good word of mouth, your friends, your family, if you're moving to an area, coworkers can always tell you, who they think would be a good fit. But it's always good to make that initial appointment. I usually say it's an interview. You're interviewing me, I'm interviewing you, and to make sure that it's a good fit, because I truly believe it's teamwork. I don't have all the answers, and the patient doesn't have all the answers. So together we have to work to accomplish the goals. And it's got to work together. If I'm doing it all, or if I'm not listening to you, neither of us are going to be happy, and your goals are not going to be met.
I'm going to come back to that in a second, but we're getting ready to go into winter. And there's a lot of holidays in winter: Thanksgiving, Christmas, New Year's, Valentine's Day. And it's been my habit to realize that many of my friends I don't recognize after winter. They would put on 50 pounds. Would you address that at all?
Yeah. I think that typically here in Michigan, where the only place I've ever practiced is, we spend the summer 6 months trying to recover from the things that we didn't do in the winter 6 months. And so much of that just has to do with activity. When you're not getting out, you're not doing your yard work outside. You're scared to go outside because you could slip and fall with all of the ice and the snow that we have. You get a lot less active. And when your body is active, your mind is active. You're having to use that hand-eye coordination. And if you're not doing that, then you will slip both mentally and physically. And then, you gain 15 pounds, and then it's very difficult to get that off. And so I'm a proponent of trying to get people to move as much as they can and just doing simple chair exercises. The good thing is that we have so much around us, so many tools. There's chair yoga. You can, Google anything and come up with it, YouTube things. And you can find a simple exercise program that is going to keep you moving throughout those winter months.
You
And
said,
then,
you said something about chair. That sort of confused me. What do you mean by, you said chair activities? What do you mean by
yes,
that?
you can do there's chair yoga. There's things you can do, even if you're sitting in a wheelchair. Just moving is so important. Doing marches, kicking your legs out, heel lifts, toe lifts, lifting your arms up, bringing them up to your sides, and those sort of things can keep you moving. And so people say, well, I can't exercise, it's not, it's not going to do me any good. And I say that's not true. Just keep doing what you can do. You might not be able to do it as intense, but if you keep moving, then things don't catch up with you.
That sounds pretty interesting. Now, I belong to a fitness club,
Mhm.
which has treadmills and all kinds of things and weights.
Mhm.
And if there's some good deals on those too, people can use that for the winter too, can't they?
Absolutely. You do a super job. If you did not do that, you would have way more difficulty moving around and doing things and recovering from the illnesses that you've had. And so that is ultimately the best thing, because you're driving, you're getting out, you're talking with people. But not everyone can do that. So, there's something for everyone, and you have to make the best of the situation that you have, whether it's the ability to get out or financially. There are ways that you can remain active through those winter months.
That's so true. And one thing I found, maybe you can address that, is just going someplace outside and exercising with other people helps me mentally.
Absolutely. Absolutely. Exercise brings out endorphins, which make you happy. So it helps your mood. But mentally, it is so good, that social interaction. And it's those people that stay, in bed. Studies have shown you can't just have the TV feeding you. You have to converse, hand-eye coordination, puzzles. Um, Crossword puzzles, anything with hand-eye coordination. You can't just listen to the news and expect to keep your mental capacity.
Do you notice, as a physician's assistant, that people that are sedentary sort of fade faster?
Absolutely. Absolutely. For everything that I just discussed, it is very difficult if you don't move uh, as we age. Just for every one day that you're in bed, it takes 4 days to recover. And it is a big hurdle for many people to be able to do that. But if you are able to do that, sometimes people get stronger after an illness or an injury, if they really have the desire to get better.
So what you're saying so far is, now that we're going into winter, look at our social life, look at our physical life, and you
Mhm.
didn't mention what you eat, because coming up, Halloween, Thanksgiving, Christmas, New Year's, there's going to be a lot of food and temptation around.
Mhm. Yeah.
You want to address
Well,
that?
nobody's perfect, and I wouldn't ever expect anyone to be perfect. But making choices is a good thing. So deciding what you're going to eat before you sit down to eat is a very good tool, because once you get there and you're talking with everyone and standing around the kitchen, you eat and you eat and you eat, and then you don't really realize how much you've had to eat. So making those decisions on what you're going to have, but I do feel it is important to have a dessert here and there, something that you really enjoy, and then it keeps you on track throughout the week if you have that. Everyone can be perfect, but there's only one way to go from there, and it's downhill.
I
And
want,
so,
I want to compliment you on your health. I know that you've taught classes on fixing food that's low calorie, less sugar, less
mhm,
cholesterol, and
mhm.
you've done real well, and you've helped many people do that.
Sugar is the root to many evils. It causes inflammation, and inflammation causes joint pain. It causes cancer. It causes difficulty remembering things. And so I try as much as I can to limit the sugar intake. And there's sugar in everything. So I encourage everyone to look at look at that package, look at the serving size, look at the added sugar, because you really want to try to eliminate that. And if it says low fat, it's high in sugar.
Now, I'm going to talk about a problem I have, and I've gotten over it. You've helped me with that a lot. Um, I have a real rough time going to a doctor when I'm sick and telling them exactly what's wrong.
Mhm,
You know this, that even though I'm not prejudiced, I had a rough time going to a woman doctor even
mhm,
and talking about some of my male problems. Is
mhm.
that common?
It can be, but I usually I think the more the provider listens, there's nothing you're going to tell me that I haven't heard. And again, it's teamwork. And if you don't tell me, I can't help you. So, but I think it is in helping people to feel comfortable and meeting them where they're at.
Okay, maybe you can tell me what you want to hear on a first visit from somebody like me.
Yeah.
What should I tell you? How should I prepare for visits?
Mhm. Absolutely. I think that, there's less and less providers. It's much more difficult to get in. And so getting the most out of your appointment is good for you, and it's also good for me. So being prepared. Um, so much of it is knowing your medications, knowing what you take and when you take it. If you're taking over 7 medications, the chance of you taking it improperly goes, sky high. So if you can bring your medications with you, that is very, very helpful. People say to me all the time, that little blue one. And I don't know, there's different manufacturers. And so for you to just say what the color the pill is, I don't know. So having your medications, every person should have a medication list in their wallet for when they have to go to the hospital. It just saves so much time, because I don't want to start you on a new medication if I don't know what medications you're on. And so many of us have programs that we put interactions in, and if I don't know that. So being prepared is bringing in your medications, making a list of things you want to discuss, and prioritizing them, because we might not be able to get to everything in that one visit. So prioritizing what is really bothering you at the top of your list.
Okay, I got a question, some specific questions about things that have been in the news. Do you mind if I ask? You may not have the answers, but you might be able to help me. Is that okay?
Sure.
Well, first off, I guess what I want to ask is about COVID, because that was really a big thing a few years ago. And I'm hearing all kinds of things. Go get more shots, do this
Yep.
and do that.
Mhm.
Is uh, is COVID as deadly? Is it as deadly as it was at one time?
Absolutely not. Absolutely not. It is essentially a strong cold. the way it is right now. So it's not as deadly as it was, back in the day, I call it. um, Medicine is always before COVID or after COVID. And so, but for example, we had way more deaths and way more significant illnesses with influenza last year than we did COVID. In my 19 years of practice, last year, 2024 had the worst, and early 25 had the worst influenza. We were seeing people hospitalized, pneumonia, just taking months to get back to their, pre illness state. And so, and vaccinations are really a personal choice for people. I think, you really need to think hard about what your risk factors are, because that makes a big difference. And, I try to meet people where they're at. And I always give my recommendations, and then it's their decision on whether or not to follow through. But if you've got bad lungs to start out with, you should be getting vaccinated, because it's inevitable that you're going to get exposed.
What about me at age? My age is older now. Should I get it if I'm older? Get shots for
Yes.
COVID and
Yep.
influenza?
Yeah. Age alone is a risk factor. Smoking history is a risk factor. Family history is a risk factor. So those are all things to take into account when you decide about vaccinations.
Okay, now we have a lot of people that are younger that watch our program,
Mhm.
and they're young mothers and everything, and they're fighting with the idea of how many shots should I give my baby? And
Right.
do you have
Right.
any recommendation or thoughts about that?
Yeah. There are very many vaccinations that are important for kids to get in their lifetime throughout the years. And when you're going around, you don't have the immunity when you're young. And so you are much more prone to getting things, and kids get very sick very quick. And I personally, as a parent, wanted to do everything I could to help my children be successful and be healthy.
That sounds like pretty good advice. I like that kind of advice. Now, what about going to a discount store or something? They got all kinds of medications on the shelves,
Mhm.
vitamins and things to keep your hair from falling out and everything. I don't know. How should I view that? Can I get healthier by buying all these medications in the drugstore?
There are some things that are very good to have, but you also that it should go on your medicine list, because they can cause interactions with the prescription medications. And so you definitely want to, you know, let your provider know what medications you're on. I usually tell my patients I'm the vitamin D police. In Michigan, vitamin D is super important. It helps your bone health, it helps your immunity, it helps your mood. And so I really feel that that is important, and that's an over-the-counter medication. The one thing I do want to say about over-the-counter medications is they are not approved by the FDA. So they can claim, they can say, it does this, and, grows 6 inches of hair in 2 weeks. That's not necessarily the case. So you always want to take that with a grain of salt, and make your decision about whether or not to take it.
That helps. Now, you recommended vitamin B for me.
Vitamin D, yep.
Vitamin D, I'm sorry. I don't
Mhm.
know the alphabet real well. C, that. But you recommended that for me, and you've even upped the dosage because
Mm.
you tested for vitamin D and I was short. Is that correct?
I test for every everyone at their yearly labs, I check for vitamin D. Now, it's not that way in every state, but in Michigan, you really get negligible amounts from milk. And so you really just get it from the sun, and we are just not out in the sun enough. And they're finding huge links to vitamin D and your immunity. And, I have my face in sick people's face all day long, and I believe it's my vitamin D that helps to keep me from getting ill. And
I want to end this program by talking about something that's important to me. What about Christ? What about healing services?
Mhm.
Do they work? I mean, if the church prays for you, do they work?
Absolutely. I fully believe that. I feel where, the expertise of the provider and the patient themselves, where they fail, um, we know right where to look. And he can provide the answers, the peace, in the healing that nobody with any medical degree can do. And it's super important to have the faith and to have your team of people that are praying for you on a regular basis, and praying specifically for what your needs are. And super important.
And you've seen it, and I've seen it too. People that we have no hope for sometimes.
Mhm.
Prayers by a church for you and your prayers alone,
Mhm.
miracles happen. You've seen
Yeah.
that, and I've seen that. It's with my own life. Correct,
Right.
Sarah?
Absolutely. Absolutely. Where he he can just do so many things, and he doesn't say that we're not going to go through bad times, but he's always right there with us to get us through. So all he's waiting for us is for us to ask him.
Well, isn't it amazing how time flies? It seems like we just started, and look at all the things we've covered. We covered a whole medical journey. So we're going to wave goodbye to everybody. Can you wave goodbye to people right now and tell them you enjoyed talking to them?
Thank you. It was a wonderful discussion, and I hope to reach somebody out there.
Lessons for life echo loud and